Lucky Land Casino, asking people, what's the weirdest place you've gotten lucky?
Lucky? In line at the deli, I guess?
Aha, in my dentist's office. More than once, actually.
Do I have to say?
Yes, you do.
In the car before my kids' PTA meeting.
Really?
Yes.
Excuse me, what's the weirdest place you've gotten lucky?
I never win and tell.
Well, there you have it. You can get lucky anywhere, playing at LuckyLandSlots.com. Play for free right now. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18 plus. Terms and conditions apply. See website for details.
Hey all, welcome back to the Real Life Pharmacology podcast. I am your host, Eric Christensen, pharmacist, board certified in pharmacotherapy and geriatrics. Thanks so much for listening today. You can track me down at LinkedIn and connect with me there. That's probably the easiest way to do it. I'm fairly active there, as well as email me at mededucation101@gmail.com. If you have any suggestions, comments, anything like that, definitely don't hesitate to reach out, like the gentleman that did it the other day, and he suggested I do the podcast on Lamotrigine, which is definitely a medication I see in clinical practice from time to time. So this drug is classified primarily probably as an anticonvulsant. I would say the two most common indications I see it used for are seizures or anticonvulsant activity there. The other one is in bipolar disorder, and particularly probably more common in bipolar depression in those type of patients. Mechanistically, how does this medication work? Okay, Lamotrigine, or Lamictal by brand name, works primarily by blocking glutamate release in the central nervous system. And if you remember glutamate and what it does in the CNS, it's actually an excitatory neurotransmitter, which makes a lot of sense. If we're going to block something, we'd want to, and prevent seizures, for example, we'd want to block an excitatory neurotransmitter, which might increase the risk for seizures. So ultimately, what Lamotrigine does from a 30,000 foot view is it really kind of settles down or calms down the central nervous system. So again, those indications, seizures, bipolar disorder, rarely. I have seen it used in headache prophylaxis, but that's an off-label use, and it's not very common. We've got a lot of other agents, in the setting of migraine and things like that, that we can and do utilize there sometimes. All right, let's talk about adverse effects. So most common adverse effects you're going to see are going to run in line with CNS depressant type activities, so sedation, for example, possibly some confusion, some dizziness, things like that. And those are generally dose dependent. So as you escalate the dose of the medication, you're probably more likely to run into that. GI upset, nausea, vomiting, that type of thing can happen as well, which is common to a lot of medications, but really the easiest way to pick that out is just the timing of the medication there. Okay, and the hallmark classic drug adverse effect that you need to know with Lamotrigine is rash. Okay, so it's not incredibly common, I would say, in clinical practice. However, it can lead to a really, really severe type of rash and ultimately end up in Stevens-Johnson syndrome and potentially could be life-threatening. So there is a boxed warning on that potential adverse effect. And I've actually seen it one time in clinical practice. What happened was, and I lay out this story in one of my books, Pharmacotherapy, but basically what happened was a patient was discharged from the hospital, and they ended up having an incorrect medication list, an old medication list. And the patient ended up being started on Lamotrigine, 250 milligrams twice daily, which is a big dose, a relatively decent-sized dose. And Lamotrigine requires this very slow dose titration. And the reason being for that is to help reduce the risk of this severe rash occurring. Okay, so typically starting doses is 25 milligrams once a day for 2 weeks, and then we go up to 50 milligrams once a day for 2 weeks, and so on and so forth. So again, 2-week intervals between increases. And the patient case that I encountered, this patient was actually started inadvertently in error on 250 milligrams twice daily because they had been on it in the past and medication reconciliation wasn't done appropriately, and that never got removed upon the admission. So a couple of points there. Definitely remember the slow dose titration with lamotrigine. Okay, be careful about being aggressive. And the other point is just a more generic point about all medications is the importance of getting that medication list right and appropriately discontinuing medications that have been discontinued in the past and making sure that they don't come up later on. Okay, so important to get those meds right on transitions of care. I've seen so many mistakes throughout clinical practice, and this example I hope highlights the importance of that for sure. So if that rash is encountered, we need to discontinue the drug. If patients have been on lamotrigine for a long time and maybe they're on moderate to higher doses, always recommended, unless it's a severe reaction, of course, but typically recommended to taper off slowly. And the reason being for that, in something like seizures, if you cold turkey stop that medication cold because you want to switch to something else, we definitely run the risk of increased risk for seizures if we abruptly discontinue that medication. So very, very important if we can, if we're just switching drugs and there's no severe adverse effect, to taper off of drugs in general whenever possible. All right, so let's take a quick break from our sponsor and we'll finish up with drug interactions. If you're in the market for pharmacist board certification study material, such as BCPS, ambulatory care, geriatrics, MTM exam, or NAPLEX, definitely go check out meded101.com/store. In addition to those resources, if you're a PA, nurse practitioner, nurse, med student, physician, we've got books on case studies, clinical pearls, things in clinical practice that you'll actually see out there. So definitely go check those out. And you can actually get your first book for free if you've never been a member of audible.com. We've got 3 currently, 3 Audible books that you can get one of them absolutely for free. So definitely go check out that offer, help support the sponsor. And you can find all those links at meded101.com/store, STORE. All right, finishing up on drug interactions. So first one that I have read case reports about is valproic acid. Okay, this is a well-known drug interaction. We need to be really careful with lamotrigine dosing and valproic acid. What happens is we get an increased risk for lamotrigine concentrations, and obviously what can happen is increased risk for that rash. So there's actually a recommended dosing titration for patients who are already on valproic acid, and it's a slower titration because remember I said concentrations can go up. So for example, the usual starting dose is 25 milligrams once a day. With valproic acid, we actually half that, and we do 25 milligrams every other day. Okay, so important to look that up if you've got a patient on valproic acid and make sure you get that dose titration right. On the flip side, we've got some seizure medications like valproic acid, but different from valproic acid in that they can lower concentrations of lamotrigine. And you may be able to guess these. These are your classic enzyme inducers. So your carbamazepine, your Phenytoin, these can lower those concentrations, and we might be able to get more aggressive with the starting dose of lamotrigine. Other drug interactions, common ones that can occur, CNS depressant activity. So lamotrigine has that type of activity, and if we're adding other agents, your benzos, your older antihistamines, your opioids, alcohol, cannabinoids, all these medications have CNS depressant activity and could increase the risk for sedation and confusion and things along those lines. And then one last one that I did want to highlight was estrogen therapy. So whether that's birth control or relief of menopausal symptoms, we're using estrogen for that purpose. They do have the potential to lower lamotrigine concentrations. So in a bipolar patient, in a seizure patient, you may run the risk of treatment failure in that setting. So important to think about and recognize some of these drug interactions, particularly if you have a patient that is potentially experiencing adverse effects, or they're potentially encountering treatment failure, depending upon what the drugs are going to do there to the concentrations. All right, so I think that wraps it up for today. Go to reallifepharmacology.com, get your free 31-page PDF on the top 200 drugs. It's a great little study guide if you're preparing for board exams or just need a refresher or something you want to give to students on rotation. I laid out the most important clinical pearls that you're tested on and that you might see in clinical practice. If you enjoyed the show, leave a rating review on iTunes or wherever you're listening. And of course, always feel free to share us with nursing students, med students, pharmacy students, and help them get a better understanding of important things surrounding medications. All right, well, I am going to sign off for today. You can track me down on LinkedIn, like I mentioned, Eric Christensen, PharmD, or send me an email at mededucation101@gmail.com. In addition, thank you in advance for supporting the sponsor, meded101.com. Helps keep this podcast free and educational for all to enjoy. Take care, and I hope you have a great rest of your day.
Hey guys, it is Ryan. I'm not sure if you know this about me, but I'm a bit of a fun fanatic when I can. I like to work, but I like fun too. It's a thing. And now the truth is out there. I can tell you about my favorite place to have fun. Chumba Casino. They have hundreds of social casino style games to choose from with new games released each week. You can play for free anytime, anywhere. And each day brings a new chance to collect daily bonuses. So join me in the fun. Sign up now at ChumbaCasino.com.
No purchase necessary. VGW Group. Void where prohibited by law. See terms and conditions. 18+.